Hello everyone. Today's topic is about anatomy of spinal cord. So today's session, where I'll be covering mainly the external features of the spinal cord, their coverings and relations of the spinal cord segment with the vertebral segment. Okay, not in detail. I would like to start my topic with two clinical cases. So this will make you understand anatomy of the spinal cord even better in relevance to the clinical aspects. The first case, where the patient was suspected to have meningitis and the physician has planned a lumbar puncture. I think you all are aware of what is lumbar puncture. So it's a procedure where the cerebrospinal fluid is extracted. So what he going to test with this procedure? Is it safe to perform this procedure without an injury to the spinal cord? And what are the layers pierced in this procedure? So this is the first case. And the second case, it's a case of disc prolapse, okay, between L5 and S1 in a student who came with the complaints of lower back pain, and it has the pain has been referred to the back side and the outer side of the right leg. So using your knowledge of neuroanatomy, explain the symptoms of this disease and which spinal nerve roots were pressed on. Okay, so now let's start with the topic, then you will come to know what are the importance with this clinical cases. These are the learning outcomes, okay. These are the topic outline. So this is the first spinal cord session, where I will be dealing with the introduction, the external features, coverings, the spinal nerves, their formation and exit, and the relationship between the spinal and the vertebral segments. So as you know, the central nervous system consists of brain and the spinal cord. Okay, so the spinal cord forms elongated, roughly cylindrical in shape part of the central nervous system. So where exactly it is situated? So spinal cord is situated in the vertebral canal. Okay, so there is a canal within every vertebra. Okay, so this is a rough diagram of a vertebra. Okay, so there is a vertebral canal. Within the vertebral canal, mainly the upper two-third part of the vertebral canal is the location of the spinal cord. Okay, so the spinal cord begins as a continuation of the medulla oblongata. You all know medulla oblongata is a part of the brainstem. So the medulla oblongata, below the level of foramen magnum, continues as spinal cord and terminates inferiorly. So if you see the spinal cord, the cross feature, okay, so inferiorly it terminates and it tapers, okay, to form a cone-shaped structure called as conus medullaris. Since why it is named conus? Because the lower end of the spinal cord tapers and resembles like a cone. That's why it is named as conus medullaris. So there is one more point which I mentioned there, that in adults this lower end of the spinal cord terminates at the level between L1 and L2. So between L1 and L2, as you know that all the vertebrae, they form a column, they articulate. So in between the two vertebrae there is intervertebral disc. Okay, so it terminates at the level of intervertebral disc between L1 and L2. This is in adults. But there is a difference in the fetal life which I expect you to find out. So this is an homework where you have to know what is the extension of the spinal cord in the vertebral canal in fetal life, whether it is the same level or if it is different. The external features, the length of the spinal cord, okay, so usually remember it has 18 inches, so it ranges from 42 to 45 centimeter in different sex, male and females, but you can remember it as 18 inches. Okay, so when you see grossly the spinal cord, okay, it is roughly cylindrical and you can see two enlargements. One at the cervical region at the level of C4 to T2 and The second is at the lumbosacral region, that is between L2 to S3 level. So why? Why there are two enlargement? Any idea? Yes. So you know that the spinal cord mainly has group of nerve fibers carrying both motor and sensory fibers. Okay, so the motor fibers mainly supplying all the skeletal muscles of our body. So you know that you had learned two plexus. The upper limb, the muscles of the upper limb are supplied by the branches which are formed at the brachial plexus, and the lower limb by the lumbar plexus. So there are a large group of nerve fibers which are present in these two ends, one at the cervical and lumbosacral, supplying all the skeletal muscles of the upper limb and the lower limb. Okay, so that's why you see two enlargement at these two levels, the cervical C4 to T2 level and lumbosacral from L2 to S3 level. As I told earlier, the lower end you can see a cone-shaped structure of the spinal cord called as conus medullaris. Okay, so here you can see in this picture the sagittal section of the spinal cord, okay, with the vertebrae. So at the level of L1, between L1 and L2, you can see the terminal end of the spinal cord. Okay, so beyond that, you can see a tail-like structure which is nothing but group of nerves, okay, which are extending caudally, okay, at the lower end of the cord, and this resembles a horse tail. So what are these group of fibers, the bunches of nerves? You know that the peripheral nervous system includes 12 pairs of cranial nerves which are coming from brain, and from spinal cord, yes, 31 pairs of spinal nerves. So these spinal nerves emerges at the level of different spinal cord segments. Okay, so these spinal nerves, how do they exit? Okay, they exit. There is a foramen in between the vertebrae. This is one vertebrae. This is a second vertebrae. So these are articulated by intervertebral disc. So between the vertebrae there is a foramen. Okay, so this foramen is between two vertebrae. So it is this intervertebral foramen which is present on either side. Okay, so through this intervertebral foramen, the corresponding, numerically corresponding spinal nerves exit. Okay, so since the cord segment ends at the level of L1, L2, the remaining spinal nerves, because there are 31 pairs, the remaining spinal nerves, they elongate caudally in order to exit at a numerically corresponding intervertebral foramina. So these group of nerve fibers, they resemble like a tail of a horse. Equina means a horse. Okay, so it is present at the caudal end, that's why the name is given as cauda equina. Okay, so these are the two features. One is conus medullaris and cauda equina. So you can see in this picture of in a cadaver. Okay, so the structure labeled 1 is nothing but the cauda equina, group of nerve fibers. The structure number 2 is the conus medullaris. Okay, the structure number 3, what is that? It's phylum terminale. So what is phylum terminale? You will come to know now. You all know that brain and the spinal cord are protected. They are well protected by different layers of connective tissue, right? The main connective tissue is called as meninges. So similarly, spinal cord has meninges from inside to outside. It is pia mater, arachnoid matter and dura mater, right? And between these sheaths, if you think this is outside, this is dura mater, arachnoid matter and pia mater. Okay, and there are two spaces within this dura, between dura and arachnoid. Below the dura there is, yes, subdural space. Then between arachnoid and pia, below the arachnoid, so it's named as subarachnoid space. So what do you see in a subarachnoid space? Yes, there is a fluid running called as cerebrospinal fluid. So these are the three layers with the spaces. But there is one more space, especially in the spinal cord, around the spinal cord, exclusively, uniquely present only around the spinal cord. So this is called as epidural or extradural space. This is present outside the dura mater, so between the dura mater and the periosteum of the vertebral canal. Okay, so if you see here in this picture, this is the periosteum of the vertebral canal, and you can see the content of fat, right? So that is the epidural space or extradural space, which is an extra space only present around the spinal cord. So around the brain only 2 spaces, but around the spinal cord there are 3 spaces: epidural, subdural and subarachnoid space. So you have to remember this. There are some special features of the spinal pia mater. One is the phylum Tourmaline, which I have told earlier. So in this picture, number 3 is the phylum Tourmaline. So what is this? So as you know that the spinal cord ends at the level of L1 and L2. There are coverings. So the pia mater covering extends still more down and gets attached to the coccyx. Okay. So this is the extension of the pia mater from the lower end of conus medullaris and gets attached to the coccyx. So this tube-like extension, okay, is called as, of pia mater, is called as phylum Tourmaline. Okay, so this extends till the coccyx. Okay, so this is the extension of the pia mater. So in this picture, the number 3 represents the phylum Tourmaline, which is a shiny structure which is covered throughout by the chorda equina. So that's why they have reflected the chorda equina at the side, so that you can see the phylum Tourmaline. The next special feature is on either side of the spinal cord there are teeth-like processes of the pia mater, that is the lateral extension of the pia mater. Okay, so these give extra support to the spinal cord, or it suspends the spinal cord in the subarachnoid space, and since they resemble the teeth, so that's why it is called as denticulate ligament. Okay, denticulate ligaments which are present on either side, okay, and it is present in between the different spinal roots. So these are the 2 special features of pia mater covering the spinal cord. One is phylum Tourmaline, other is denticulate ligaments. Now coming to the clinical application. So the first case which I discussed beginning of the class, that is a patient suspected with meningitis, where the physician has planned to do lumbar puncture. So this is the procedure where they do to extract cerebrospinal fluid. So where exactly it should be done so that there won't be any injury to the spinal cord? Okay, so as you know that in adults it ends at the level of L1 and L2. Okay, so anywhere below L2, if the needle is inserted, okay, there won't be any injury to the spinal cord. So commonly it is done between L3 and L4 level. Okay, so how do you recognize the L3 level? So the main surface marking is the iliac crest. At the back, the surgeon or the physician who performs the lumbar puncture, they feel the iliac crest, which will be at the level of L3 spine, and below that the needle is inserted, okay, which is attached to a stillet. Okay, then it pierces the different layers. What are the different layers pierced by the needle? Please find out. Okay, once they have a giveaway sensation, then they pull, they extract the cerebrospinal fluid. So what is the purpose for this? Okay, so the case only told you that the patient had meningitis. So for the diagnostic purpose, what is the cause for the meningitis, whether it is bacterial, fungal or viral, to find out that the CSF is extracted. The other use is to inject drugs whenever they want to give the treatment for any infection. So through this also the drugs can be injected, and most commonly this is the procedure where they use for spinal anesthesia or caudal anesthesia. So whenever there is a surgery below for the lower body, okay, so the anesthetic agent is injected into this level. Okay, so this is called a spinal anesthesia or caudal anesthesia, also done during labor. Okay, whenever the female wants a painless delivery, Okay, so that time also this anesthesia is used. Okay, so this is one of the clinical applications, spinal tap or lumbar puncture. So here I have given a homework. What is epidural anesthesia? This is one more type of anesthesia. So please find out. Now coming to the spinal nerve formation. Okay, so you know that how many spinal nerves are present? There are 31 pairs of spinal nerve exiting through numerically corresponding intervertebral foramina. Okay, so the spinal, so if you take a section of the spinal cord, so it has outer white matter, inner grey matter. Okay, so I won't be going in detail about that. Let us know how the spinal nerve is formed. So spinal nerve has two roots. Okay, one, so this is the posterior aspect of the spinal cord, this is the anterior aspect. Okay, the spinal nerve is formed by two roots. One is the dorsal root or the posterior root, okay, and one is ventral or the anterior root. Okay, the spinal nerve is formed by two roots, dorsal and ventral roots, also called as posterior and anterior roots. So these roots have different functions. The ventral root mainly carries motor fibers which supplies all the skeletal muscles of our body. Okay, not only that, it has fibers, preganglionic fibers supplying blood vessels, internal organs, all those. So I won't be going in detail. Okay, in general, the formation of spinal nerve I will be talking. Okay, so ventral root, please remember, it carries motor fibers supplying the skeletal muscles. What about the dorsal root? It conveys sensory fibers entering the central nervous system. Sensory fibers, that is from the skin, muscle, joint, okay, carrying different sensation, pain, touch, temperature, vibration, joint sensation, all those are conveyed and they pass through the dorsal root of spinal nerve. Okay, so when you see the spinal nerve, is it motor or sensory? Motor is also called as efferent and sensory is also called as afferent. Efferent means motor, afferent is sensory. Okay, so ventral root is efferent, dorsal root is afferent. Okay, so these two join and they form a mixed nerve called as spinal nerve. Okay, so neither side. So these spinal nerve exit through numerically corresponding intervertebral foramen. Okay, so this is the formation of spinal nerve. Okay, so there are 31 pairs, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. So how do they exit? When you see the first 7 cervical spinal nerves, C1 to C7, they pass through above the numerically corresponding vertebra. That means C1, if you think C2 spinal nerve, they pass above the C2 vertebra. C3 above the C3. Okay, so this is from C1 to C7. You know that there are 7 cervical vertebrae, but spinal nerves are 8 in number. So C8, since they don't have the corresponding 8 cervical vertebrae, so the C8 passes above T1. Okay, that's the first thoracic vertebra. Caudal to that, all the spinal nerve go below the corresponding vertebra. That means first thoracic spinal nerve passes below the T1 vertebra, T2 below T2, so like that. Okay, so this is how they exit. So this is a table which tells the relationship of spinal cord segment to the vertebral number. So you know that the growth of vertebral column doesn't coincide with the spinal cord growth. Okay, so they don't coincide. Vertebral column, they grow rapidly in length and they doesn't correspond with the spinal cord segment. So the physician should have in mind whenever there is injury or a fracture or a dislocation of the vertebra, which spinal segment is corresponding at that level. Okay, at that particular vertebral level. Okay, what do you mean by spinal segment or a cord segment? It is a portion of spinal cord where the particular spinal nerve are attached. okay, which gives attachment to the each spinal nerve. So that is called as segment. So in the spinal cord, this is first cord segment, means it is giving attachment to the first spinal nerve. Okay, so this table summarizes that. Okay, cervical vertebra. So in the cervical vertebrae, you should add 1. So if it is C6 cervical vertebra fracture, so which spinal cord segment corresponds? So plus 1. So it is C7th spinal nerve, cervical spinal nerve. If it is upper thoracic up to T6, it is, you have to add 2. Okay, T6 vertebra means add 2. Which spinal segment? It is 7 and T8 spinal nerve. So lower thoracic, add 3. So like this. So this gives an idea to the physician so that he can remember that at this vertebral level, this cord segment is present. Now coming to the clinical application of spinal cord and spinal nerve injuries. So degree of spinal cord injuries corresponds to different anatomical factors. Okay, so cervical, usually the fracture of the vertebra is most common where there is articulation of a mobile vertebra with the immobile part. For example, at the cervicothoracic region or at the lumbosacral region, because these two are the most vertebral part which undergoes movement. Okay, so it corresponds to different anatomical factors. So the lumbar region below L1, the cord segment injury is very less common because the cord ends at the level of L1 and L2. But when you see the spinal nerve injuries, again it is very common at the cervical and lumbar region because these are the areas which undergoes disc prolapse because they are more prone for the, means they are the one where the movement occurs more. Okay, so that's why they are more prone for disc prolapse. So you had a case at the beginning, a student having a disc prolapse at L5 and S1. So the student not only had lower back pain, but the pain referred even till the leg, till the foot and outer side of the leg. That's the back and the right side of the leg. So why? Because at L5 and S1, there are the nerves, spinal nerves, L5 and S1 spinal nerves are exiting. Okay, so maybe the student is having a lateral disc prolapse, so it might be compressing L5 or S1 nerve. So you know that L5, S1 form the plexus and they supply the leg region, the back. Okay, the sciatic nerve, all those are at the level of the leg. Okay, so that's why the student is having a referred pain from back extending till the leg. Okay, so in detail about the injuries you will be learning at the next class. Okay, so this ends my session. These are my references. Okay, thank you very much.